My name is Aquinette Harrison. I am a Master of Divinity student at St. Thomas University. I will be sharing with you today on the topic of living after a stillborn birth. Society calls a woman who is pregnant an expected mother. A expected mother expects to give birth to a child that she can nurture for years. She does not expect a stillborn birth. According to the American Pregnancy Association, stillborn births affect over 2,500 families a year in the United States alone. It affects all races and all socioeconomic statuses. The mother experiences shock as she goes from the happy expectation and anticipation to the pain resulting from the death of a long-awaited child. Throughout this presentation, the personal pronoun you will be used. In most instances, the word you will refer to the mother of the child. This presentation is intended for the entire family as they are a support system to the mother in coping with her loss. Fathers are affected by the loss in ways we may never know. Some men are not as expressive or open as women. Marital and family relations suffer as a result of this loss as each party attempts to cope with the loss in their own way. However, each needs the support of the other party during this ordeal. Marshfield Clinic makes note that grief is the making meaning out of the loss and the life without the child. There are no quick fixes. Healthy grieving is a process, and no two persons grieve in the same manner. So you are suffering such a loss? Upon hearing the news, you are faced with choices. 1. To name the child, to hold the child, to keep personal items from the birth. Do not allow someone else to coerce you into making such quick decisions. You will have to live with the decisions in the months and years to come. Holding the child can be healthy in the process of healing. Choosing not to hold your child will not, as many say, to get over it. Remember, your child is not an it. He or she is a human being. Give your child a name and invite others to respect your child by calling him or her by name. Your child will always be a part of your life. Choosing to keep a few of the items, such as a copy of the baby's footprints or handprint, does not, as others say, impede the healing process. Denial is not a way to begin the healing process. One way to establish memories while grieving your child is in journaling your thoughts of the moments as a means to healthy grieving. As the moments pass, what should you expect? Holidays will come, thoughts of your child will appear. Birthdays will come. Whether you grieve at the graveside or remember your child in some other way, it is okay. Invite your support system to join you as you remember your child and continue the process of healthy grieving. A quote from Dr. Keith Manning states, "Your child's birthday can be a day of remembrance and reflection." You do not have to grieve your child in silence. There are support groups for parents dealing with the loss of a stillborn birth. Stay your course, keep advancing toward hope. What about the surviving child? Surviving children are those who must deal with the loss as much as you, the parent, and other adults. After awaiting the arrival of their new sister or brother, the surviving child deserves an explanation of the death of their baby sister or brother. Don't try to spare the child pain. Be honest and forthcoming about what has occurred. As the mother or father, it's okay to designate another adult to do so. Children need to know it is okay to grieve the loss of their brother and sister. The Center for Loss and Life Transition notes that the most important thing you can do is to listen and accept the feelings of the surviving child. As a parent or grandparent, do not think that you have to have all the answers. It is important that you are responding in a way that shows that you care. The MIST Foundation states that allowing children to participate in arts help in the healthy grieving process. Older children can journal through expressions as an outlet to healthy grieving. Reading is a healthy tool for children of all ages. Reading to your younger child is an integral part in the healing process as a bond of love and attention after the loss of their sibling. Grandparents, you can assist the parent in showering attention on the surviving child. For instance, you are riding past a cemetery and the child remembers the grave graveside ceremony and inquires about their sister or brother. Be truthful in the way that the child can understand. Give the child age-appropriate answers. Support the child in his or her understanding of death, so as he or she grows up, the child does not develop a warped sense of what death is all about. Be a source of assurance. Miss Foundation notes, a tragedy that is not properly identified, counseled, nurtured, and then accepted can devastate families both individually and collectively. In summary, how you grieve is a legacy to your stillborn child and the surviving child. Know that there are helpful tools and support groups for mothers, fathers, and the surviving child. Grief is a family affair. You must grieve individually as well as collectively. If it gets hard for you, seek professional help. You do not have to go through this process alone. Thank you for listening, and may you be strengthened by what you hear.